While virtually everyone who works out or is into fitness wants a good set of abdominals, like the six-pack abs, while they do look good, and of course they're mostly a result of low body fat and diet, however, when people train them too much, that can be problematic because they can become overactive. And the overactivity is a problem in one scenario, and that's when the spine is extended, when you're in a pattern, especially if you call the PEC pattern. If you are a PEC or a patho-PEC, let's just say PEC for now, and if you don't know what that is, you'll have to look it up. I've covered it in a lot of different videos on this channel, so this may not make sense unless you already know what a PEC is. This person is in a state of extension, and in that, if you look at the attachment sites for this rectus abdominis, these rectus abdominals, you'll see at the sternum and the ribs, and then all the way at the bottom, at the top of the pubic area of the pelvis. So when you go into extension, that attachment site gets pulled apart further away. And now you're trying to strengthen those abs in a lengthened position. It's really not going to provide anything good. Let's just put it that way. And in fact, you're probably ruining your chances of getting better if you're in pain, first of all. But you're also ruining your chances of ever learning to breathe with your diaphragms because you're strengthening a dysfunctional state in which your diaphragms cannot be engaged. And I'm going to show you a PRI technique from the website, and you'll be able to find it right on the website and download and everything. It's there. And I'm going to walk you through that technique to show how that technique will turn off overactive and tight rectus abdominals. And I bring this up because I had a young gentleman, he's in his late 20s, maybe 30, and he was complaining. I saw him on Monday, and he was complaining of tight abdominals and also pelvic floor pain. And you'll notice those abdominals, they attach so low, right above the pubic bone, and then the pelvic floor is right underneath it. So they're intimately attached. Those are intimately attached. The function of the rectus abdominals, when they're overactive, by definition, the pelvis will be forward on one or both sides, and when that happens, the pelvic floor on the bottom is going to be tightened or mispositioned. So there is that link right there. But what you'll also find, and what I saw with him, was that his shoulders are forward quite a bit. So you often find this. Overactive pec minors on both sides because of what's going on a little bit lower. And then he also had a major forward head posture. His neck was very limited in its ranges of motion. Again, they all go together. So if you have an overactive or overly developed six-pack abs on a spine that's extended, you're almost always going to have tight chest, tight shoulders, and a tight neck because you can't breathe with that situation. So you're going to overuse your neck and your lower back to help you breathe. On the other hand, what you do need are the internal obliques and transverse abdominis. I only have the internal obliques here in this little diagram. And those internal obliques, what they will do, notice how the muscle fibers run exactly opposite of how the six-pack abs muscle fibers run. They will bring that area back together again. So they're going to help bring you from an extended state with the pelvis forward and ribs up to a state of flexion, which will bring the ribs back down and the pelvis back to reestablish a neutral starting position. You need the neutral starting position, otherwise you cannot diaphragmatically breathe. If the diaphragms do not have the ability to pump because they're mispositioned, because you are mispositioned, an extended spine will not have diaphragms that can go up and down with every breath you take. If they can't go up and down with every breath you take, the rib cage can't expand. So before you can start to breathe diaphragmatically, you have to get yourself back into a state of neutrality through systemic flexion and learning how to breathe in that systemic state of flexion, which will then help restore neutrality. Doesn't mean you live like that during the course of the day, because that's what everyone always asks. The techniques are used to get you back into a state of neutrality. No one's saying you need to bend over and breathe the whole day. That's not what it's about. But what you will see in this little picture, as you get that rib and pelvis, what we call internal rotation, because it's all internally rotating, You'll get a posterior movement of the body. Your back will move back. When you're extended and you arch, your body moves forward. Your body weight shifts over the balls of your feet. The weight moves towards the toes. Your head comes forward. Your chest is up, and everything's moving forward. You need to learn to go back. So as you flex, go into spinal flexion, or systemic, it's not only spinal flexion, your whole body's going to go into a state of flexion in the technique I'm going to show. The whole thing goes into a state of flexion. Your legs will go into a state of internal rotation. Your arms will actually be internally rotated. Your ribs will be internally rotated. Your pelvis will be internally rotated. Everything has to go into a state of internal rotation and then learn how to expand from a state of external rotation. Misspoke. You are learning to expand from a state of internal rotation into a state of external rotation. Didn't want to redo the whole video. You can't expand into external rotation of your body if you're already stuck in a state of external rotation. You have to alternate cycles of internal and external rotation. A PEC is stuck in a state of external rotation all the time. That's why they can't breathe. So when you see the technique, the PDF, which I'm going to just kind of point out the important parts, it's producing a movement of the body that's moving back. And that's what your brain has to sense, and that's the position you have to get into to allow yourself to get back into a state of neutrality, so then you can diaphragmatically breathe and not have to overuse your neck and your low back for breathing, which will then allow you to stabilize your pelvis and do everything else that we talk about in postural restoration and on this channel, pretty much every video I talk about. And here is the technique, and it is on the PRI website. And they actually have a lot of techniques on this website because they did a webinar a year and a half ago in May of 2020. And there's a lot of techniques in this webinar series about, they called it breathing in COVID times. So it's all about breathing. At the basis of all PRI is breathing. So if a lot of people want more techniques, well, there's a lot of them on the website, and I'll put the link in the description for the video description. There'll be a link to this one, but if you search around a little bit in May of that year, and if you go to the page that is about this webinar series, you'll find a lot of them. You can try a lot of different things. So this technique in particular, what is it doing? It's taking you out of an extended state that I know you're in, at least. Well, yes, you'll just have to kind of go along with the fact that if you're in, I've never seen anyone seek help from me, and that was not in an extended state on one side of the body, on the left, or both on the right. So they're either going to be in that left AIC pattern or a PEC pattern. Regardless, extension is the problem. So this position is putting you into a state of flexion. Your ankles are flexed, your knees are flexed, your waist, your hips are flexed, your spine is flexed, your shoulders are flexed. Everything's in a state of flexion by coming forward. The important thing you'll also notice, however, that she has a book behind her heels. That book is giving her brain a sense of hamstrings. Heels equal hamstrings. Her butt and lower back are against the wall. That's really important. Her upper body is against the wall. The band in her hands allows sensory input to go through the hands so her brain can start to use her shoulder blades properly. A lot of people, if they try this technique without a band or something to push against like a chair, their brain's not getting it's the strangest thing until you see it in action. But in order to relearn how to use your shoulder blades, your scapulas, which if they're not engaged properly, you will overuse your neck for everything. When those shoulder blades are not sitting properly on the rib cage, those shoulder blades will be controlled by your neck, and the shoulder will also be controlled by the lat in an undesirable way. So having the hands against those bands will help in the whole process during inhalation to hold that position. So she's just getting into that position. She's sensing the ground underneath her heels, the ground underneath her heels, the book behind her heels, which gives hamstring sense. Her brain is getting a sense of the ground coming up underneath her. She's feeling the wall behind her lower back, and she's feeling sensory input through the palms of her hands. And I'm pretty sure the palms of her hands have more sensory input receptors, mechanoreceptors that respond to pressure than possibly anywhere else in the human body. Don't quote me on that, but I think even more than the feet. So they're important. Having your hands touching things other than a computer mouse and a barbell is really important. You got to start to use your hands differently. And all of this is going to allow her to actually breathe diaphragmatically because she's now in a state where she can expand her rib cage because her rectus abdominis is turned off. A lot of people can't get their air out properly, so they can't get into this position because the abs are overactive, they're tight, and they're being used to hold you up because you're falling forward. In extended posture, when the pelvis tilts forward, you're essentially falling, so you have to arch your back and use your abs to try to stabilize you in an upright position. Your rectus abdominal your six-pack abs should not be used as postural stabilizers. However, when you're stuck in a pattern like this, that's what's going on. That's why the tension is occurring. So this, getting that ground underneath the feet, behind the heel, the wall behind the lower back and the butt, that is giving her brain a sense of stability that she's not going to fall, and then those abs can finally let go. And that's what I did with the young man. I did this first, and then I did a 90-90, and 90-90s are on my website, and you can find them all over the internet. And his breathing went from, it was very odd breathing in the beginning because his abdomen would expand, and then there would be a little movement of the rib cage up here, but it wasn't synchronized. After these two techniques, everything was rising and falling as one unit, which is what we were looking for. So again, this technique is designed to help someone finally breathe with their diaphragms in a position that a lot of times the hands and knees position or the 90 position may not work great for them. The only other change that you could make to this is you don't necessarily have to use the band. You could not use the band, but you could also not go quite so low. You could keep your lower back and more of your mid back against the wall and just reach forward in that position. And there is something between her thighs, pretty high up. That is for as it says, an ischial-femoral ligament stretch. That doesn't have to be, you don't have to use that. You could put a ball between your knees, which will give adductor engagement. If you only feel your right adductor, you also want to feel your left, so you might want to ease up on how much you're pushing your right knee into the ball and use a little bit more left. But again, this is a great technique for PECs. This is something I would use for PECs. Maybe not this exact, well, I may use this one for PECs also. But anything in this position, this wall-supported reaching type of position, and there might be more on that page on the PRI website. You just have to check it out. But this is what I would use, something like this, I would use for PECs, but it's all about expanding the rib cage with air and to restore proper breathing mechanics with sense from the ground, which PECs do not have. If you liked this video and found it interesting, could you please like it, share it, comment, or subscribe to the channel? Thanks.